Hi, I'm doing this video because I'm pretty sick and tired of hearing many stories of children who were suspected of ADD or ADHD, sent to psychiatrists, they diagnosed with ADD or ADHD, and they were not feeling any better. It's crazy, to hear children that are on 8 to 17 medications altogether, which includes antipsychotics to help them to sleep, things like benzos to help with the anxiety, and a couple of other antidepressants as well. And some were given anticonvulsants, and these are medications that damage the brain. And research has shown that children who are on Xanax had brains that look like alcoholics. Historically, US President Abraham Lincoln had depression, and back then in the 1840s, medical professionals were bleeding them, having mercury to purge the tumor out from their body. So everyone back then seemed to be playing some kind of guessing game in terms of mental illness. They look at the patients, they talk to them, and they try to diagnose them based on the symptom clusters and treated them. So isn't that the same way how we today treat our patients too? We send the patient to see a psychiatrist, a psychologist, and the psychiatrist or psychologist look at the patient, listen to them, do a mental status exam, and decide what they have. And that's crazy. So psychiatry today is no different. Say somebody had a depression. So the psychiatrist will look at him, diagnose the patient based on symptom clusters, and treats him with a pill known as maybe SSRI. And most psychiatrists give anyone who hits the symptom of depression an SSRI pill. And research, interestingly, shows that SSRI don't work any better than placebo. Now, please don't misunderstand. It's not that I'm saying medication is not good. There are benefits of medications at times. Like, for example, if we find a person with low activity depression and we put the patients on Wellbutrin, it works really great. But I think the bigger problem here is that psychiatrists or even psychologists rely so much on the DSM, which assumes that psychiatric symptoms are simple disorders, that one size fits all, one treatment fits everyone. And from a neuroscience perspective, that is really crazy, because a person who is depressed may also have overactive brains, and we need to calm them down. And certain parts of the brain may be underactive, and we need some kind of stimulations there. So some parts of the brain could be overactive, and while some parts of the brain could be underactive. And it's therefore our job as medical professionals to balance them. So I hope that people who are suspected of mental illness will consider a brain scan or at least a brain-directed assessment. So thank you for watching this, and please share this video to anyone you think may be useful. Thank you.